first case of COVID-19 was reported, schools were closed. When the government initiated phased reopening of the schools had challenges of lack of hand-washing facilities, inadequate supply of water, inadequate infrastructure such as classrooms, toilets, dormitories. SNV supported the training of curriculum support officers and other field officers on COVID-19 prevention.
On enhancing access to hand-washing facilities, we did this among schools, identified schools, those that were deemed very needy. And so we did this together with the Department of Health and also with support from the Department of Education.
In March 2020 in Nakuru, that's when we had the first case, and all our WASH partners came on board, and part of those WASH partners is SNV, and with SNV we were able to prioritize school health activities. So the first thing we did was assessment of the schools which had not been sensitized on COVID-19 and WASH. Basically, the teachers and the non-teaching staff, they play a very big role in behavior change when it comes to learners in school.
Mtu kama huyu atapatwa na ugonjwa sababu mavi iko na germs.
Go round. Every finger, don't leave it out, eh? Make sure that you come up to the wrist. So, yeah. After that, you do what?
You
now rinse.
WASH First in Kenya, implemented by SNV, civil society organization networks and county governments, upon rapid assessment identified the education sector as a key intervention area in Nakuru, Kericho as well as Homa Bay and Elgeyo Marakwet counties. Across the 4 counties, 383 schools benefited from training of teaching as well as non-teaching staff or sensitization during the handing over of hand-washing facilities. 4 of these schools benefited from gender-sensitive, inclusive sanitation facilities, as well as hand-washing facilities and soap.
Our key stakeholders are the Department of Health Services, Ministry of Education, Teacher Service Commission, Ministry of Interior and Coordination, that is the County Commissioner's Office, Department of Early Childhood Education, Department of Trade, and the community. During handing over of the facilities to the schools, the health club in particular and representatives from classes were sensitized on COVID-19 prevention, operation and maintenance of the facilities, just to ensure it has water and it has soap all the time.
When I came, the condition was not good. We didn't have enough pit latrines, and it happened that a team was going around. When they came and assessed our situation, it was so bad, and they went on with our report. That is the SNV team. They took our report that we were in a very poor situation. The few pit latrines which were there were flooded, and that was just to add on the number. They were just too few.
This is the report of the
Thank
school
you,
and
thank
all the
you.
project.
Thank
It's a
you
well
so much.
and a well done project.
Thank you so much.
Use it properly
Yes.
for the purposes of the pupils and the intended purposes.
We are grateful. Our pupils are going to be happy, and they are going to start using this facility from today. We are very, very grateful.
Thank you.
One of the schools that was selected to benefit with the project at the SNV was this school, the Highway School. This school had a lot of challenges in terms of provision of latrines, because the population of the school is around 790. We had a big deficit because generally would say as per our regulations, we required not less than 26 pit latrines, yet we were only having 7.
Being a school that is in a slum setup where water is not accessible to most of the families. So when the children come to school and they find like they have good toilets, they have a good hand wash facility, it's really helping them. It's really motivating them. It is reducing maybe the diseases that the children would be affected with if this facility was not available.
On 1st of November, the project was handed over to us, having been complete. with the toilet facility, 4 doors, a urinal. We have the hand washing facility. We have a storage tank, and actually it is so good.
These are the facilities that we were using, both the primary and the ECD learners. Now the SNP assisted us, and we have the better one, which is fit, and it is so convenient for the learners. We have this mural that they have done to us on the COVID-19.
If you walk into a school that those activities took place, you can see behavior change. That is, in terms of, as you walk into a wash facility, you'll find kids are washing hands. The health club members play a key role in maintaining the wash facilities and even mentorship to the younger children.
In every school, before we start the implementation of the project, we are bringing on board the management. So the management owns up. At the same time, they ensure there's provision of water because we know it is very critical. You have to have the infrastructure.
Expect the school health club to meet with the community health workers in the community so that they share. So that whatever is taking place in the facility, they take the information to the household level, and then it is cascaded to the school, forth and back.